Herpetic stomatitis is an infectious disease, and as the name suggests, it is caused by the herpes simplex virus. It tends to have a severe onset with symptoms of general intoxication and localized lesions of the mucous membrane. It is believed that in about 80% of cases we are dealing with herpetic stomatitis, especially if it presents with characteristic signs. We see this disease in great concession to children. For example, in a kindergarten, in a particular group, we observe an outbreak of stomatitis. Most often, closed group infection. So this is how it spreads, and children very often like to share sing sweets, chewing gum, or they might lick a toy, play with it, and pass it around. So this is essentially how the transmission mechanism works. The source of infection is a sick person, a sick child. Subsequently, it spreads within this particular closely interacting group of children. How does the pain appear? Pain, refusal to eat. It can manifest quite noticeably with a symptom called hypersalivation. The diagnosis is hypersalivation, meaning the child has excessive drooling. Sleep disturbances. What does herpetic stomatitis mean? It is gingivitis, that is a lesion in children of the gums and blisters. Everything depends on how pronounced it is and how many of these blisters there are, as well as their diameter and quantity. Sometimes they can be from 5 to 20 blisters that do not rupture. They form painful erosions nearby, and then they become covered with a fibrinous coating. This is essentially how the disease manifests itself at this stage where it appears, whether on the hard or soft palate. It could be on the tongue, it could be on the cheeks when we open the mouth and move the cheek aside with a spatula, even without looking deep into the mouth. We can already see some of those blisters. They have clear contents at first, but over time they become cloudy, then rupture, and such erosions form. These erosions are painful, which is why children become restless and irritable, and they refuse to eat. The illness usually lasts about 5 days, and sometimes even submandibular lymphadenitis can occur. In general, blood tests. Sometimes we do a blood test, but sometimes parents don't manage to do it in time. They turn to a specialist too late and instead treat the child with folk remedies. Still, the manifestation of a viral infection is typically a neutrophilic shift to the left, sometimes with an increased ESR. But how pronounced are these viral changes in the blood? And here, specifically with this disease, leukocytosis is possible. So it's important to clearly understand whether we're dealing with herpetic stomatitis or actual stomatitis. Specifically with this disease, it is possible manifestations similar to a bacterial infection may appear, such as a mild leukocytosis. And these kinds of symptoms, like those seen in bacterial infection, yes, urine test is advised for cylinders, albumin or kidney involvement. They often occur together. The simplest and most reliable method, though not very simple, but the most reliable is the detection of the virus by PCR, for example, a polymerase chain reaction, detecting the virus in these vesicles. That is, you can take a simple swab, send it to the lab handles this, and based on the analysis, they will tell you what you. If the herpes virus is detected in the biological material, you have herpetic lesions. The treatment of the disease is still primarily local. Even though this is herpetic stomatitis, we do not use the systemic drug acyclovir or other. We do use it, but mainly topically and sometimes orally. For local anesthesia, gels are used with lidocaine, and for local antiseptics, chlorhexidine is used. For example, miramistine can be used. It is also possible to use 5% acyclovir ointment. It can be applied to the red border of the lips. You can apply it to the tip of the tongue so that the child can make a few movements like this. The effect will be narrower than the cavity on the mouth, directly on the blisters themselves. In severe cases, acyclovir is indeed used for children over 2 years old. 200 mg 5 times a day for 5-7 days. if we have confirmed the etiology of this disease as herpetic stomatitis. In severe cases, when we see signs of secondary bacterial infection, antibiotics are indeed used. I want to reassure parents because, of course, everyone thinks that stomatitis can be treated at home. All moms and grandmothers. I would like to warn you, in any case, consult a specialist. Here, local treatment may be possible, the disease may resolve on its own, or the child may require more in-depth treatment and a more thorough examination.